मेडिसिन गवर्नमेंट कॉलेज यूनिवर्सिटी फैसलाबाद। आज के दिन जो है वो बहुत अहम है इस लिहाज से कि नेशनल काउंसिल फॉर तिब ने आयुर्वेदिक का सिलेबस जो है वो FTG में शामिल कर दिए हैं, जिससे जो है वो FTG की वर्क जो है वो बढ़ गई है। अब FTG के लोग जो है वो एक्यूपंक्चर जो है उसका भी मुतालिया करेंगे और उसको प्रैक्टिस भी कर पाएंगे। ये एक अहम जो है डेवलपमेंट हुई है जो कि काउंसिल ने अप्रूव की है। तो आज जो हमारा टॉपिक है बेसिकली वो है ब्लड। ब्लड जो है वो एक फ्लूइड टिश्यू होता है जो कि सर्कुलेटरी सिस्टम के अंदर या हार्ट चैम्बर्स के अंदर जो है वो सर्कुलेट करता है। हीमोग्लोबिन कंजुगेटेड प्रोटीन है जिसके अंदर हीम और पोरफाइन होता है या प्रोटीन होती है जिसको ग्लोबिन कहते हैं। हीम कॉन्स्टिट्यूएंट्स अबाउट 4% ऑफ द हीमोग्लोबिन, यानी हीमोग्लोबिन के अंदर जो हीम की मिकदार होती है वो 4% होती है। इट इज ए complex of iron with a tetrapyrrole derivative known as protoporphyrin 3, also known as protoporphyrin 9. Globin constitutes about 96% of hemoglobin molecules. Now the porphyrins. Porphyrin consists of four pyrrole rings joined together through methyl bridges. Each of these four rings have two groups attached to each other. These groups are methyl, vinyl, and propionyl groups. Various porphyrins differ from each other in respect to these groups on pyrrole rings. Steps of porphyrin and heme synthesis. Formation of uh, delta aminolevulinic acid (ELA). Formation of ELA results from the condensation of succinyl-CoA with, with glycine catalyzed by ELA synthase. Reaction requires pyridoxal phosphate as coenzyme. It is a rate-limiting step in heme synthesis. Activity of ELA synthase is decreased by elevated concentration of heme or hemin. Hemin is produced by the oxidation of ferric to ferrous. Uh, Hemin forms crystals, characteristics of human blood. Heme accumulates when the production of porphyrin exceeds the availability of globin and other apoproteins. Accumulated heme is then oxidized to hemin. Formation of porphobilinogen. Porphobilinogen is formed by condensation of two molecules of ELA. The reaction is catalyzed by ELA dehydrogenase. The enzyme is extremely sensitive to inhibitions by heavy metals, lead, hence lead poisoning results in anemia. Formation of uroporphyrinogen. Uroporphyrinogen is formed by the condensation of four molecules of porphobilinogen. This condensation is catalyzed by uroporphyrinogen synthetase and co-synthesis. It is formed in three steps, which are as follows. These molecules of porphobilinogen condense to form a molecule of methane. A molecule of tripyryl methane splits and forms one molecule of dipyrrole methane and one molecule of pyrrole derivatives. Two molecules of dipyrrole methane condense to form uroporphyrinogen. Formation of protoporphyrinogen 3. Protoporphyrinogen 3 is first converted to coproporphyrinogen 3 in the mitochondria. Coproporphyrinogen 3 leaves the mitochondria and enters cytosol. In the cytosol, coproporphyrinogen 3 is converted to protoporphyrinogen 3. Formation of protoporphyrin 3. In mitochondria, 6H are given off from protoporphyrin 3 to form protoporphyrin 3. Heme formation in mitochondria, protoporphyrin 3 combines with iron to form heme, catalyzed by ferrochelatase, an enzyme inhibited by lead in lead poisoning. Clinical features. Clinical notes are heme synthesis, lead poisoning. It results in anemia. Anemia is caused due to the inhibition of alpha dehydrogenase and ferrochelatase by lead. Coproporphyrin 3 and LS accumulates in urine. Heme containing compounds. Heme can combine with several other proteins to form important compounds: hemoglobin, myoglobin, cytochrome, peroxidases, and catalase. Urinary excretion of porphyrin. Uroporphyrin are excreted in negligible amount. Coproporphyrin excretion increases in lead poisoning, liver disease, and hemolytic anemia. Urinary excretion of porphyrin are greatly increased in a group of disorders called porphyria. Fecal excretion of porphyrin excretion increases in hemolytic anemia and decreases in liver disease. Clinical features. Porphyrias. Porphyrias are caused by inherited or occasionally acquired defects in heme synthesis, resulting in abnormal accumulation and increased excretion of porphyrin precursors in urine. They are classified as erythropoietic, enzyme deficiency in RBC, or hepatic, enzyme deficiency in liver. Porphyrias are inherited as autosomal dominant disorders, except congenital erythropoietic porphyria, which is an autosomal recessive disorder. Types of porphyria. Acute intermittent porphyria. It is due to deficiency of uroporphyrinogen 1 synthetase, porphobilinogen, and delta ella accumulates in the urine. Urine darkens on exposure to light and air. Patients are not photosensitive. Congenital erythropoietic porphyria. It is due to deficiency of uroporphyrinogen 3 co-synthetase. Uroporphyrinogen 1 and coporphyrinogen 1 accumulate in the urine. Patients are photosensitive. Porphyria cutanea tarda. It is due to deficiency of uroporphyrinogen decarboxylase. Uroporphyrinogen accumulate in urine. It is the most common porphyria. Patients are photosensitive. Heredity porphyria. It is due to deficiency of coproporphyrinogen oxidase, coproporphyrinogen 3, and other intermediates block prior to the block accumulates in the urine. Patients are photosensitive. Symptoms: acute intermittent porphyria, abdominal pain, and neuropsychiatric disorders caused by the accumulation of ALA and porphobilinogen. Any drug that introduces microsomal cytochromes P450 enzyme systems often precipitates the symptoms. For example, barbiturates. P450 enzyme system is a heme containing system. It is made up of many enzymes and is present in liver. It is responsible for detoxification and neutralizations of drugs. Photosensitivity is seen in all porphyria except acute intermittent porphyria. It is mainly due to the abnormal accumulations of tetrapyrrole intermediates. Photosensitivity means that the skin itches and burns when exposed to sunlight. These symptoms are believed to be due to porphyrin mediated formation of superoxide free radicals from oxygens. For oxygen derived free radicals, uh, we, destruction of cellular components due to these oxygen derived free radicals causes photosensitivity. Common features: decreased heme synthesis is a common feature of all porphyrias. Heme normally functions as a precursor. Decreased activity of ALA synthetase. The absence of heme causes an increase in the synthesis of ALA synthetase. The ultimate result will be increased synthesis of intermediates that occurred prior to the enzyme block. Treatment: intravenous administration of hemin diminishes the severity of symptoms of porphyria. Hemin acts to decrease the synthesis of ALA synthase. It avoidance of sunlight Ingestion of beta carotene antioxidant, a free radical scavenger is also helpful. Degradations of heme and formation of bilirubin will be uh, discussed later. Thank you very much.